Good morning. I hope everyone's up and at it. Might need a little help. I had a little coffee to help me along the way. I am so delighted to be here. I met Tracy, a couple of years ago. I really came to this area. Didn't know a lot about lupus, but if anybody's on the call from Montgomery, Alabama, they may know a really fierce advocate for lupus down in that area, Dr. Ruth Bradshaw. She ran a lupus group for many years in the Montgomery area. Her church, forgot the name of the Methodist church, but just decades on decades in Montgomery. And she would invite me down to speak and to talk to her support group and get to know the ladies. And one of the things that I talked about with her was that there were very few lupus support groups in rural areas. My work at the University of Alabama School of Medicine, I'm at the branch campus in Tuscaloosa. We are really focused on working in rural Alabama, and I'm particularly focused on the Black Belt area of Alabama. No support groups there. And the other thing we also knew when I learned going to the lupus support groups was really the disproportionate number in African American women. So that's really what got me on the journey. I talked to Tracy and we started a group she helped me start a group in Selma, Alabama. And that group is still going. I think it's been about 3 years, Tracy, I think somewhere around there. And then shortly after that, about 6 months to a year after, we started a group right here in Tuscaloosa. Tuscaloosa, of course, is not rural, but it serves a lot of rural communities around it. We actually get some of our members come as far as Columbus, Mississippi. So really sort of a regional approach. So I've just been happy to be involved from that aspect with lupus. So it's interesting. This title is Double Jeopardy. As you saw from my bio, I'm a preventive medicine public health physician. So that's really my take home message constantly is prevention, primary prevention. Of course, there's secondary and tertiary prevention, but I'm really honing in on preventing people from getting disease in the first place. And then I'll talk, I'm going to throw in just my work with disparities because there are gender disparities with heart disease, as many of you know. So that's what I'm going to really key in on. So my disclaimer is I am not a cardiologist and I am not a rheumatologist. So keep that in mind. That's why I kept the presentation very general and sort of honing in on those two topics, prevention and disparities. So I'm going to show a video first, and then we can go from there.
And you're going on a tour
in May.
Oh my gosh.
I haven't gone on a world tour in a long time.
No kidding.
Oops, sorry. I was trying to bring this sound up. Sorry.
That'll wake you up.
Again. It will, if I can get it going.
My next guest is a true superstar.
That's not it.
I think you need to change your screen that you're sharing to your
it went to the next video.
Uh-oh.
Oh, okay. Here. I have it. I had it pulled up anyway. I just it interrupted when I went on the.
In May. I haven't gone on a world tour.
What is going on?
It wouldn't be a webinar if we didn't have some little glitch, right?
Yes, that's right. That's right. I'm going to leave it so that it doesn't keep interrupting where it is. Okay.
Tour in a long time.
No kidding. Yeah, I guess it's been a while.
I'm doing great. I have lupus, so it's been a little challenging for me traveling and serving my body like that. Doing well.
That has to be taxing on the body.
It is.
Yeah. And so, how long ago were you diagnosed with lupus?
Like 7-8 years ago.
What don't people know about that?
I mean, it's my particular type of lupus. It loves my heart, meaning it affects it often.
Right.
I get pericarditis often. I get viruses of the heart. I get microvascular angina
Yeah.
Some people say angina.
Angina.
But when I say that, people look down.
Right,
Like,
yes.
can we focus?
They think they misheard,
It's so
something.
hard.
Right.
And blood clots and things like that. You know, when you travel, when you fly.
Yeah.
Not
So
funny.
many autoimmune diseases.
Autoimmune
people don't
disease,
understand.
yeah, absolutely. It loves my immune system. It attacks itself and everything in my body. So it kills everything, like your immune system is like the police and tells you, you go here, you go there.
And probably nobody gives you any, like, nobody cuts you a break because I look at you, you look so healthy, you look gorgeous, like you look perfect. So, you know, when you don't show your symptoms on the outside, sometimes people don't really
I agree.
take that.
And performers, we tend to hide it a lot. Like you have Selena Gomez. I mean, she is a warrior.
Yeah.
You know,
Yeah,
she
she
had
sure is.
renal failure. Survivor. I'm not going to be a victim of this disease, so I'm very proud of it.
So I'm going on a world tour.
So I showed that to really just talk about, I was really impressed
And you're going on a world tour?
with her knowledge of let me stop this. I'm trying
And I
to
think
get back
some
to the
of us may
presentation.
not have,
Casey.
some folks may not have seen the video.
think I
That
can-
was
You know
Tony
what? I can come
Braxton.
out of this. Let me come out of this. There we go. Yeah, I was impressed with Tony Braxton's knowledge of her disease. I mean, and the way she explained it well, and really keying in on her cardiovascular disease. So I just wanted to show that to let people become a little bit more aware. The other thing is that when I'm talking to my medical students, I tell them that the Go Red campaign is really about disparities with women in cardiovascular disease, and really, and I asked them, why do you think the American Heart Association does the Go Red campaign? And they think, because we're talking about health disparities, I talked to them about a study called the Georgetown study, where in, I think it was 89, 99, somewhere in that time, it was what we call the seminal study in health disparities. Most of the research in health disparities has been done in cardiovascular disease. And these doctors, they were primary care doctors. They had simulated patients that came in with similar symptoms, but the only differences between the patients were some were Black, some were white, some were male, some were female. And the doctors prescribed less aggressive treatment for the women and for the Blacks and for Blacks. And so the question is why? And that's when we said there might be implicit bias in the providers' interactions with both women and Blacks around treatment options, around the way they treat their patients. And that would have consequences in the outcomes. And when I asked them why, they're thinking, and it's really because we don't have data on heart disease in women because they're not in clinical trials. They haven't been. We're getting them more in clinical trials, and the same thing for minority groups. So those are things we have to correct, and that's why the American Heart Association has the Go Red campaign, is to increase awareness that women have heart attacks and heart disease just as much as men. It's the #1 killer in women. And not just for the public, but also for providers to really understand that. And this statement I got off their website, nearly 80% of cardiac events can be prevented. Cardiovascular diseases, as I said before, continues to be a woman's greatest health threat. So, but the key word is prevention there. So, of course, many of you know about lupus. I just wanted to sort of reiterate the point that all body systems are affected. This is mainly we're talking about systemic lupus erythematosus, SLE. When it gets into the bloodstream, can affect any of the organs, and we see here, as well as the cardiac system. I have here but all the others as well, muscles and joints, skin, brain, but heart and lungs. And this is one question that doctors should ask. Have you ever felt chest pain while taking deep breaths as well? So in general, we know, as Tony Braxton talked about, It is a chronic inflammatory disease with circulating autoantibodies. So really anti-self process. I'm keying in on the word inflammatory because that's going to be important even as we talk about cardiovascular disease. You have activated T cells, immune complexes, and inflammatory cytokines. And that's what I'm talking about with the inflammatory sort of processes. Lupus in the heart, really the take-home message is that lupus patients have an increased risk for heart disease because of that increased inflammation. So that's really what I want you to take home with you. If you look on the left, the standard risk factors that we still need to look at, even if a person has lupus, is age, hypertension, hyperlipidemia, hyperglycemia. So diabetes, diabetic, or people living with diabetes have an increased risk for heart disease, smoking, and genetic factors. But add to that on the right, the SLE related risk factors. Remember, I keep talking about that inflammation, systemic inflammation, autoantibodies, immune complexes, of course, the activated complement products, you probably heard that term, nephritis, and dyslipidemia as well. So you've got a picture here of some of those processes going on when you have lupus, which contributes to the heart disease. All layers, you heard Toni Braxton talk about some of the specific issues with cardiovascular disease. I think she talked about viral, she did talk about pericarditis. Remember, there are so many layers in the heart and that lupus can affect any of those layers. I'm going to show you a picture in a minute of the different layers. Pericarditis, it can affect the pericardium, the myocardium, the actual heart muscle, the valves, the electrical system in the heart, and the coronary vessels. So those can cause all different types of issues as a result. So these are the layers of the heart. It's just, if you look down in the bottom, they just took a section out of the muscle layer, and you can see there's a fibrous layer on the outside, a peritoneal, parietal layer, which is serous of the pericardium. There's a fibrous pericardium, and then the serous pericardium, and then the pericardial cavity, then the epicardium getting closer into the myocardium where the actual heart muscle is, and then the endocardium. So various layers. And the one on the outside that we saw, the pericardium, is a sac, actually a fibrous tissue that surrounds the heart. Remember, we talked about the fibrous and the serous part of it. Inflammation of the pericardium occurs in about 11 to 54% of lupus patients, which is a large amount. Often occurs at onset or with relapses. Sharp chest pain is usually what you feel when you have a pericarditis. Fever, because remember the itis is an infection, and treated with non-steroidal anti-inflammatory drugs or steroids. Okay, myocardium, infection of the myocardium causes myocarditis, and it's often referred to as the heart muscle. Remember, I said the layer closer into the heart, and it's at the actual muscle that pumps, where the heart pumps. Inflammation of it occurs in about 7 to 10% of cases, and it usually is viral. It could be bacterial as well, treated with steroids. If it's bacterial, of course, it's treated with antibiotics, but if it's viral, it's steroids. And this can lead to heart failure. If you think about it, the heart, if the heart is not pumping well because of this infection, it becomes dysfunctional, and this is what causes heart failure. The heart doesn't pump as well as it should, and causes a lot of fluid backup, and etc. And this is what we call heart failure. It also lupus can affect the valves in the heart. So they're what we call inflammatory lesions, usually on the mitral or atrial valves. These are the valves in between the chambers of the heart. If you remember some of your anatomy, you have the top part of the chamber is the atrium, and the bottom is the ventricle. So the valves flow blood in between those areas. And so you can get inflammatory infections and involvement in those areas as well. For most patients, it's mild and asymptomatic. Some people may have it and not have any symptoms, but sometimes it can lead to symptoms and valve leaking or stroke even as a risk factor for stroke. And there's a thing called Lehman-Sachs disease, which is a part of this process. So this just talks about the relative risk. Again, we're talking about lupus patients being more at risk for cardiovascular disease. And this is compared with normal others. And this is from the Framingham study. So you see that the non-fatal myocardial infarction, the risk is a little higher in lupus patients, 1.7. And then due to coronary disease alone, not as much. So overall coronary disease is up as well, and stroke. So this is just comparing the risks compared to non-lupus patients. So there is an increased risk for lupus patients. So I talked a little bit about Lehman-Sachs. That's an endocarditis. It's a form of non-bacterial thrombotic endocarditis. This is a different type than the other one I talked about. It's a term used for small sterile vegetations that develop on the cardiac valves of patients with SLE. So this is the same as the other one. It's commonly affects the aortic and mitral valves, and the vegetations can be found in approximately 1 in 10 patients with SLE. So coronary disease, that's the #1 killer in even non-lupus patients, where you have obstruction of the arteries. And so coronary arteries are the blood vessels that supply blood to the heart. You see a picture here of some of the major ones in the heart. Coronary artery disease is increased about 6 to 10%, was seen in about 6 to 10% of lupus patients. Smaller vessel inflammation, vasculitis, usually can occur in younger patients with active SLE, and larger vessel inflammation, that's atherosclerosis, usually in older patients. And that would make sense because we know, remember, older age is a risk factor for cardiac disease, usually coronary artery disease in older patients. So prevention is key. And this is what I really want to key in on. Remember, I talked about primary, secondary, and tertiary prevention. So really, the key is to really think about from the primary perspective, getting a handle on high blood pressure, right? Hyperlipidemia, because those are all risk factors, hyperglycemia, smoking cessation, weight management, physical activity, lower threshold for adding steroid-sparing agents, increased use of antimalarial. So even some of the drugs we use for lupus, we have to pay attention to as far as cardiac disease is concerned, and hyperhomocysteemia and treatment with folic acid. So you see here some numbers that we should pay attention to. The goal really for blood pressure is to bring it down to a level below 130/85, that top number being 130 systolic, and 85 being diastolic. Hyperlipidemia, you see here, we're talking about LDL, low density lipoprotein is really the bad lipid. HDL is the good lipid. So the higher the HDL, the better. The lower the LDL, the better. Or ideally even lower than that, 100. And also paying attention to our fasting glucose as well, if you're diabetic, and your doctor can tell you what those levels are if you get your annual exam. Smoking cessation is important. So there are treatments, nicotine replacement, formal cessation programs, counseling support groups as well. Weight management, this is keeping our BMI less than 25. And this is something I have to work on because my BMI is more in the 30, 31, 32 range. So it's a constant battle. So of course, thinking about physical activity and our nutrition. I think your session today is going to have a nutritionist. So all those things are important for really keeping your BMI at a good level. The physical activity goal is usually 30 minutes a day. That's 3 to 4 times a week. Some would say even more, 4 to 5. Some people would also bring it up to 4 to 5 times a week. So the national goal is 150 total minutes per week. And how you do that, it doesn't really matter, but getting that 150 per week in. You see here, it talks about atherosclerotic cardiovascular disease. There's some other things you need to look at with hyperlipidemia if you have that. I can talk about myself. I'm a hypertensive. So I've got the triple threats with the hypertension, with the hyperlipidemia, and with the weight little increase. So my doctor has me on medicine to keep my blood pressure low. I'm also on a pretty high dose of medicine for my LDL to keep that at a good level. Though that level is good. My hypertension goes up and down, but for the most part, it's pretty good. But really, for me, working a little bit more on my weight control. So prevention at all levels, though, those were really dealing with more, not just primary prevention, because remember, I told you I already have hypertension and hyperlipidemia, but just trying to keep it controlled. Of course, weight management, physical activity, and some of the other things I'm going to talk about would help with you even getting into some of those risk factors. So it's good for really at all levels. But the ABCDE acronym for really thinking about prevention with heart cardiovascular disease is A for aspirin. Some people take baby aspirins, 325 milligrams for prevention. I'm allergic to aspirin, so I'm not on that regimen, but some are. ACE inhibitors are another way to really think about heart disease. Other medications, B, beta blockers, and really watching your blood pressure. C for cholesterol and this the medication for blood thinner. Can't really remember how you pronounce it. Some people are on that to really keep them to prevent strokes. D for diet, weight and diabetes, and E for exercise and really continuous education. So A, B, C, D, E for prevention at all levels. Hypertension is frequent among patients with lupus, and studies show that it's more prevalent in SLE patients than in patients without lupus. And this was an analysis, 235 patients at the National Institute of Health who meet at least 5 criteria for lupus indicated that 45% of patients had hypertension. So really the connection between lupus and hypertension is strong. So really controlling that hypertension is very, very important. And this is, of course, we talked about that blood pressure. Remember I said 130/85? Well, some would even, you see there with the orange, it says 130 and then 130 to 139 to 80 and 89. So really elevated, when you get over 120, you need to start thinking that you need to start continuing to really control the systolic level. It's now that doctors are really getting much more stringent on really having tight control of that hypertension, because research shows that the tighter the control, more into this less than 120 range even on the top and less than 80 on the bottom is going to be helpful and preventive. So really thinking about keeping that blood pressure tightly controlled is important. And I'm sorry, this is so weird over here, this graph, but really the point is that the more risk factors you have, you adjust your cholesterol and lipid levels based on that, and that really helps you in prevention of the disease. It gives you more time, the more you can bring your risk levels down and really meet your LDL goals for having a cardiac event. So very, very important. Cardiac rehab, I want to mention because this is also sort of a tertiary prevention. We are now paying more and more attention to a supervised program really helping you with your cardiovascular health. It has 3 components: exercise counseling and training, education for really heart healthy living, that's the nutrition, and counseling to reduce stress. Stress is just as important a risk factor for cardiac disease and probably other things, even managing your lupus. So it's in there as an important component, and we'll talk about this a little later. They have found that these programs can prevent cardiac death, 23 deaths in 1,000 patients in one study. You know, the cost is $1,200 is really, this is cost savings, I believe, and it's usually done 3 times a week for 12 to 16 weeks. So it does pay to really have a program where you're really, intentional program where you're really paying attention to your cardiovascular health. I know that there are programs, coaching, there's health coaching and things like that that are really, really helpful for people because it gives them sort of a prescribed program that they can really adhere to and really helps with their prevention activities and behavior modifications. So really important to pay attention to. Of course, we've got to talk about prevention, healthy diets, fruits and vegetables, whole grain and high fiber. I'm actually working with a group. The Ardmore Health Institute is really a proponent of high grain diets, high fiber diets. And so I'm becoming more and more of an advocate of this. Alcohol drinks, really paying attention to your alcohol, drink free, greater than 1 a day. Sodium, paying attention to your sodium, your saturated fats, and limiting trans fats. And then exercise management. Remember, I talked about 150 minutes per week. This is a moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity. Of course, I've got some knee issues, so I can't do and of course with some with lupus, that's an issue. So, but some activity over the course of the week, combination of both, they say, but spread out during the week is better. Adding muscle strengthening, very important as well to really protect our bones as we get older, at least two days per week. Spend less time sitting, and even any light intensity activity can offset some of the risk of being sedentary. You gain even more benefits, they say, if you add more minutes per week with your exercise, but also increase the amount and intensity gradually over time. And this is, I wanted to stress the stress reduction because in addition to our paying attention to our diet and our exercise, we've got to really think about ways to reduce our stress. I love this from the American Heart Association, 10 things you can do to reduce your stress. Meditation, of course, it's been interesting during this pandemic, Tracy. Me and my husband have had time to pray. We have an altar at our house now, and we actually pray every morning. I mean, it has become such a part of our life. We hate that the pandemic came, but that's something that kind of forced us into meditation, and it really helps. It's probably because the number one slows you down, really gives you time to think and plan ahead. They say sleep more, This is a major issue for me. I don't get enough sleep, but thinking of ways to help you get more 7 to 9 hours of sleep a night. Stop worrying, laugh it up, get connected. That's why I love the idea of support groups, because that gives you a community that you can connect with. Get organized, practice giving back, volunteer, be active every day, give up bad habits, and lean into things that you can change, because you can't lean into things you can't change, but lean into things you can. Develop a new skill, work toward a goal, or love and help others. So that's it. These are some of the citations here, but thank you so much for just that general. I hope you got those take-home messages of prevention, of how important it is for women, particularly those with lupus, to adhere to the heart disease prevention. So I thank you very much.
Well,
And I'm going to
thank you
come out of
so
this.
much.
Sure.
You mentioned that the pandemic has given you and your husband time to pray more and focus
Mhm.
on that as kind of stress relief and spiritual practice.
Mhm.
It's really interesting. This webinar and all the virtual education that we've been doing at the Mid-South chapter has kind of been a result of the pandemic, because we spent a lot of time
Right.
focusing on in-person support groups
Right.
and running around doing walks. And what we found is that some of the people who most wanted and needed to be engaged with others were
Mhm.
either too sick to go to in-person events or more inclined to do it on the computer. So that's been a nice little, side benefit for us too.
Right.
So,
Yes.
I think a lot of us as lupus patients, because you have so many things that hit you on a daily basis, you tend to try to find the silver lining in a lot of situations.
Yeah,
So
but
that's
it's so
something
funny that the person that traveled the furthest for us from Columbus, Mississippi, that's about an hour and a half, hour and 15-minute
Mhm.
drive. We can't get her on the webinar. I think she really liked the
you know,
face-to-face
yeah,
interaction. Yeah, she really looked forward to it. So it's sort of a back and forth. I mean, of course, the
Mhm.
webinars give you an opportunity to bring more people
Right.
in. So
Mhm.
because if travel
Yeah.
was an issue, then bringing more people in, the opportunity to open it up for
Right.
people to engage is better. But it just depends on preference, I think, as well.
Mhm.
But the
Absolutely.
support group is a connection mechanism that's a part of that stress reduction.
Mhm.
Remember it was on there?
Absolutely.
Yeah. So I think it's
Absolutely.
just so important for also others to understand that they're not going through it alone. There are other people
Mhm.
who are going through it, and to support
Right.
and support each other in it. Yeah.
Right.
Yeah.
And that's something that I think survivors of anything
Mm-hmm.
are often surprised to find that when you find your people and your
Mm-hmm.
folks who have been through the same thing, even though
Mm-hmm.
lupus has so many different variations, it's very comforting to know that
Yeah.
you've got access to a group of people who have been there, done that.
It's
And
empowering and uplifting. Yeah.
absolutely. And
Yeah.
also empowering is when we have someone who has been diagnosed for years, who
Mm-hmm.
encounters a newly diagnosed patient, and they're able to share some of their um, hard acquired wisdom
Right.
with them.
Right.
It's very, very empowering and kind
It
of
is.
gives you a sense of purpose.
It
You
is.
talked about meditation. How did you start? And a lot of people equate meditation and prayer. How did you kind of start that process of getting better at meditating? I know they call it a practice because you don't just do it well when you first start. How
Right.
did you get engaged with
Well,
that?
there's this whole area now called mindfulness. I don't know if you've heard
Yes,
of it,
I have,
Tracy.
and we have a speaker on mindfulness at 1:15.
Yes. So mindfulness is a practice, probably along with meditation, yoga, some of those practices where, and just like prayer, where you
Mhm.
really just kind of get out of yourself, really, and you're intentional about really just focusing in Quiet, usually it's quiet. You can do music, like me and my husband, we usually play a couple of gospel songs, spiritual songs to get us in the mood, right? And then we light a candle. We actually or sit at our altar, and it's a time to really, and that's really what prayer is, to come out of yourself, to connect with something. Of course, us in our experience, we're Christian, with God. But mindfulness is sort of the same thing. You get yourself quiet, and sometimes you'll have a guide that takes you through, think about your breathing. Same thing with yoga. Just think about your breathing. Let's go from head to toe. And it's a way to kind of focus in, to really relax, because when I do yoga and the teacher is talking, it just really relaxes you and gets you focused in on your body as well. And and I know there's more and more growing literature about the whole practice of it. Slowing down your breathing helps with getting probably more oxygen to your muscles. They're probably physical effects of it. It probably helps your blood pressure, your blood pulse, all those things, which are probably beneficial over the long run. So positive thinking, all of those things kind of play into that, and it certainly can
Fantastic.
help with. Yeah, I think in addition to the heart disease we're talking about, it probably helps with lupus,
Mhm.
with the lupus,
Well,
because I've heard.
we know of the connection
I've heard some
between
of the.
stress and lupus flares. So
Yes,
absolutely anything
yes,
you can
exactly.
do to, and there's a lot of, there are a lot of people now who practice mindfulness, like you said, with the candle.
Mhm.
Lemon, for some reason,
Yes,
makes me feel energized and calm. So if I'm working and
right,
I'm starting to have lupus brain fog, if I can find my lighter, I will burn my lemon
right,
candle and
right.
kind of get some
That's a good
a
idea. Some,
little
some
olfactory
people
lift
say
from that.
calming.
Mhm. Well, you have a question
Yes,
in the
yes,
Q and
yes,
A
yes, yes. Yeah, you're
from
all sort of
Rhonda.
connected, so it makes sense that it would help.
Sure.
Okay,
Uh,
okay. What
And
is
Rhonda
Rhonda? Can you
is,
read it?
I
Can
want
you read
to,
it?
I want to tell you all something about Rhonda because I need to remember later. Rhonda is a member of our first class of virtual ambassadors through Lupus University that we'll tell you a
Oh,
little bit
wow.
about later. So I'm going
Okay,
to call her out on that. So,
okay. I can't see Rhonda's question. Can you read it for me?
okay. Yes. What if your HDL and LDL are both high?
Okay, so the HDL, remember I said that's the good cholesterol. That's good if your HDL is high. If your LDL is high, that's not good. So you would really need to get treatment for that. They're counterintuitive. They work oppositely to do really. HDL takes cholesterol out of the body. LDL brings it in. We need a little cholesterol in our bodies for our membranes, cell membranes, but we don't need an overload. The overload goes into the blood, and that's the problem that clogs the arteries and the blood vessels. So you want your HDL. The HDL, they say, is increased by exercise. Some people naturally have it, but exercise tends to bring their HDL up. The LDL is probably controlled more by exercise as well, but more by diet. So really controlling your trans fat and your fat intake for both of those as well. And your exercise really helps with that. But for some of us, like me, Rhonda, I'm on medication because she knows I've cut down on my regular bacon. I don't do as regular bacon as much, but I do a little bit. But I do more turkey. I've learned to kind of move into more lean meats. But still my diet is probably not the best. It's gotten a little better. So my physician has me on a Lipitor 80 milligrams, which is high because of probably I'm not controlled. One thing I do want to say with behavior modification is you don't expect somebody to go, who's never exercised to then run a marathon, right? The small
Right.
baby steps are so important. The small baby steps. So for me, I can get on an exercise for 2 weeks and do well, and then I'm off for 2 weeks. So my problem is consistency. So the
Mhm.
consistent person, really disciplined person. I was on a call last night, I think 2 nights ago. One of my mentors, he's in his 80s, and he's like, okay, I got to get off the phone. I got to exercise. That's what when you're really saying, that you're really being consistent to your schedule, really doing it, 3 to 4 times a week, really thinking about your schedule, not just for your work or just not just for work, but thinking about your schedule for exercise, for diet. My other problem with diet is I'm not a great meal planner. So when I get hungry, then I'm going to eat whatever, whatever's available, or if I'm out, I'm going to get fast food. So really, those people that are real intentional and really think about what they're doing in a systematic way, it's really good. So there's a question here I see about information about hypoglycemia and lupus. I saw more information, Bernadette, about high and lupus as being a risk factor, the hyperglycemia as being a risk factor for lupus. I don't know about hypoglycemia. Good question. I'm sure, I don't know if there's anything on the website, Tracy, about that.
I just looked, and there's not anything at resources.lupus.org. Most of what's out on the web is in medical language, and I actually found, I didn't know there's veterinary lupus. Apparently dogs have lupus and they have hypoglycemia, but Bernadette doesn't want to know that. Bernadette is also one of our fantastic virtual advocates. So she's looking for that information, probably not just for herself, but to share with other lupus patients. Bernadette, I'll work on getting something for you on that.
I don't know.
And Gretchen
and I don't know.
who's going to be up in about 3 minutes, will probably have some information about hyperglycemia as well.
Right. Yeah, because I don't know what the percentage of the population is hypoglycemic compared to hyper. Of course, hyper is going up. Diabetes is increasing because of obesity, of course, in the nation, and particularly in the South. I mean, we've got to talk about our food and what we eat. And those are the other questions, correct, Tracy?
Yes, that's it. That's it.
Thank you so much.
All right. Well,
you.
thank you so much.
Yes.
You are so fantastic. To let you guys know, this is not the only time that you're going to be able to hear from the wonderful Dr. Pamela Payne-Foster. She is going to speak to us on March 30th and our Tuesday night Lupus Club that many of you have participated in. We'll give you more information about that later. She's going to speak again on heart health, and probably very similar to this presentation. But then on some date that escapes me right now, in April, she is going to speak to a nationwide audience about health disparities. That April is Minority Health Month, and as we know, there's a really disproportionate effect of not only lupus, but almost everything else on minority communities. So the more we know about that, the more good we can do, and the more we can spread the word. So thank you so much for being with us, and I look forward to seeing you again. I miss all these people. I love to go visit folks, and Pam is a good person to try new fun restaurants and know all the hot spots in Selma and Tuscaloosa and everything like that. So thank you so much.